The Dr. Terri Show is presented by Evexias Health Solutions. Evexias Health Solutions is an emerging leader in the integrative medicine on a mission to positively impact people's lives through the transformation of healthcare. Evexias educates and trains practitioners on the new, innovative, integrative therapies that support a preventative care model that drives vitality as you age. You can learn more about Evexias Health Solutions and many of the healthcare topics we discuss on the Dr. Terri Show at Evexias.com. That's Evexias.com, as well as find a provider near you. Now here's today's episode. Hey everybody, welcome back to the Dr. Terri Show. Today, I'm so excited about our guest, Dr. Matt McCormack, who is going to have a conversation with me about drug-free care for families from birth. Drug-free care? What? How are we going to do this? Well, we're going to talk to Dr. Matt, and he has a doctorate of chiropractic from Palmer College of Chiropractic West. He spent the last 9 years experiencing this miraculous power of chiropractic care, specifically in pediatric and family chiropractics throughout Life University and the Pediatric Experience. He's certified chiropractic sports physician and is certified in the Webster technique. We'll learn more about what that is when we talk to Dr. Matt here in a few minutes. Join us in the conversation. Well, welcome, Dr. Matt. Thanks for being here.
Thank you for having me.
Yeah, I'm excited about having you on, and there's just so many different conversations we're going to have in the coming weeks and months. But I want the audience to kind of get to know you first, and your focus, is this concept of drug-free care for families from birth.
Exactly.
So how did you get there, and tell me what that means and what that is? And I'm just going to go on record in saying that my background is in adult medicine.
Yeah.
So kids aren't my forte, although they should be because I have 7 in our blended family. Yeah. But as far as treating and diagnosing, I know a lot, but this is definitely going to be an area where you shine. So let's talk about that.
Sure. Yeah. I mean, kids are first of all, so exciting to work with. It makes my day-to-day in the office enjoyable. And I think it's unlike any other realm that I've experienced. So it keeps me coming back every day for more. Because kids and families are empowering when you get to help them, when you get to help them through their stories and their challenges and see them grow. Mm-hmm. I think it helps build healthier adults.
Absolutely.
The family unit, we need a lot of focus on how can we make that family unit stronger. And if we have a kid who's challenged, who's struggling, that makes everything more stressful, especially when they're brand new. So your concept of, and I love what you're saying because, man, my brain just went ping, ping, ping in so many different areas because it's my brain
that's
too.
What we talk about when we're talking about even hormone optimization in adults and how can we get people off of all these drugs that are really causing so much dysfunction. And so I love this concept of, being drug free. So when you're talking about that, what does that mean to you?
Being drug-free?
Uh-huh.
I mean, as a chiropractor, my tool set is different. My training and my background are different, and I think that's to a huge advantage to me right now. I think families are looking for something different, and right now our kiddos, unfortunately, are overstimulated.
Absolutely.
They're overmedicated, and honestly, they're overdiagnosed. Mm-hmm. It puts them in these buckets that I think gives them an unfair outlook at what the real potential for that kiddo can be. And if we can just lay off some of that stuff and focus on that kid's true potential in a drug-free way. And I talk about optimizing their nervous system, and I'm not treating a diagnosis. I'm not even diagnosing them when they're in my office. We're working on that whole kiddo's potential. Mm-hmm. And when we can do that in a way that gives them the power, and we're not diagnosing, we're not giving them medication, their potential is endless.
Absolutely.
And that's where you see some really cool changes, some really cool miracles happen in the office.
That's so cool. And, one of the things that makes me think of, too, when you were talking about putting kids in buckets based on their labels, well, I have ADD or I have XYZ or whatever acronym you want to throw out there, which is usually tied to some sort of medication. And it sets up to me in this mindset of, I can't function in life without these things, or I'm a victim of this thing.
Yes.
It's got to change the way they see themselves and their potential as adults.
and their expectations from their parents as far as what they can reach in life. I absolutely agree with you. And if we're talking about a little tiny kiddo, they don't necessarily know they've been diagnosed with that yet, but they will.
Yeah.
But certainly our teens and our young adults, if they have those diagnoses as they're going through high school and college, I don't think that they will shoot as far or shoot as high as they otherwise would have.
Absolutely.
Because they feel like they have this label that's anchoring them to a diagnosis and to a medication where they can't reach their potential without it.
I know you probably have so many stories. I mean, I would imagine kind of like what we do with adults and getting them off some of these medications that were never meant to be a long-term solution. You know, one of the things we talked about and this show is all about is teaching our audience, whether they're clinicians or consumers of clinicians' care, how can we shift the mindset in our country from this reactive sick care system to a proactive, true healthcare system? And everything you're doing is definitely part of that. But I would imagine you have great opportunities to get a lot of these kiddos maybe off some of these medications.
Yeah. And that's one of my first questions. I do a deep dive on our intake paperwork with these moms and dads talking about the child's case history. And we even go all the way back to birth and some of the stressors pre-birth during that prenatal period, because I think it all ties into what's happening with that nervous system. And unfortunately, a lot of kids are on medications right now. And I ask them, how long they've been on them? Are they helping? And what's their plan, for their kiddo, for themselves? Do you want to stay on these long term? And oftentimes, they've never even thought that through.
It's never been an option in their mind that, this is eventually we're going to get off this.
Right.
It's just like, here's your prescription.
Right. Exactly right. And it's just something I think is such a short-sighted thing. We give them a medication. Now they feel anchored to that diagnosis, and they need that medication to get through their day-to-day life. Right. But there's no talk about an exit strategy.
Yeah.
So I plant that seed, and I work with them to realize their body can innately heal, start to function better, and then hopefully work with their primary to start to reduce or remove those medications. Yeah. Kids have such an amazing resiliency to be well. I think about, I got to tell a story about my granddaughter and hopefully we'll, in some of these little teasers, we'll get to show stories of you helping her. But as you know, and I'll just share this with the audience, she was a big baby, but she had a difficult birth. Yes.
And she had what's called a shoulder dystocia, and she was stuck. I mean, mom was laboring down and pushing for hours.
Yes.
I was in the room, and I have a background of labor and delivery, so I knew what was happening, and it's different when you're the mother and the grandmother in there trying to, because I knew what was coming, and it was scary getting that baby out. Yeah. To say the least. And that first cry, I'd choke up thinking about it. It's like, oh, thank God. But fast forward going along, I mean, this is a breastfed baby. She should be doing well. She should be pooping normally. Yeah. Her poop was a weird color. Yeah. And, mom's like, I'm not eating anything weird. I'm taking my, what is happening? And then, your wife works with me at my clinic, and, that exposure to, and you had just opened your clinic, and my daughter bringing, baby Eleanor in, and you started working on her and doing some adjustments. And then, the next thing you know, this baby is, within 2 treatments, pooping the normal breastfed yellow poop, like it's supposed to look, and sleeping. So talk about what's happening there,
Yeah, great question. And no one will celebrate poop and sleep, I think, more than a pediatric chiropractor. We talk about it all the time in the office.
It's probably the 2 most important things across the lifespan. If you're not sleeping and pooping, there's a lot going wrong. You're cranky.
Yes, things just get worse from there.
Exactly.
So I talk about those things, especially for those newborns, as being the foundational components of a healthy nervous system. Yeah. They should be eating, sleeping, and pooping. If they're not doing those regularly or they're not doing those efficiently, then we start to see so many other issues. Mm-hmm. And with a tough and difficult birth, and that's one of the things we jump into with the paperwork and mom's story. At that point, mom is sharing the story for baby Eleanor of how pregnancy went, how delivery went, and then however long it's been until I get to see them. Yeah. Right? And for her, it was a very short amount of time.
A couple of months.
So I'm trying to fill in the gaps on how much stress this baby has had and where that stress has set up shop. And for a long labor, difficult pushing, I believe there's manual extraction as well. Mm-hmm. And that's really I give a workshop called The Perfect Storm, and that's one of the things that is so important is how that baby is delivered. If you think about any other time in that newborn's development, the first thing we do when you have a baby is you tell everyone that that's holy might support the head. Their head and their neck are weak. They're not yet coordinated, but in that moment, and sometimes it's necessary, so I can't fault the docs at all. When we are manually extracting, it happens a lot in a C-section. I was a vacuum extraction. I had a lot of these same issues. There is so much pulling and rotation on that baby's upper neck, and what that does to their...
They literally went in and turned. I knew what was happening.
Yes.
Turned her and pulled her, broke her shoulder.
Yes. Yeah, so that gives you an idea of how much force had to be used in that moment. That can be life-saving, for sure. It's also life-altering. So now you have a baby that comes out. Their neck and their vagus nerve, there's a lot of dysfunction there. They might not be able to rotate fully. They're going to have difficulty latching. They're going to have difficulty nursing. They're going to have difficulty sleeping. So they're a colicky baby that can't breastfeed. They're going to go to their pediatrician for the first few weeks. They're going to be recommended to go on formula.
Yes.
They're going to tell them, oh, there's colic. They're going to grow out of that colic, right? And I hate hearing that because they don't have to suffer through these windows of stress. Parents or children. The whole family suffers. And if we can get in earlier is better, but we can start whenever they come into the office. If we can get into that nervous system and start to actually make some positive change to calm it down and to activate the vagus nerve, we will see that kiddo very quickly start to sleep and start to poop, because that's a huge function of that vagus nerve.
Absolutely. Yeah, and so, I just for a visual, I know, maybe people are thinking as adults what we do, we go to the chiropractor, and you're not even doing that. My daughter would send me pictures, and you're just really holding her, and it almost looks like you're just massaging her, and she's happy. She's got this big smile on her face. But kind of explain what are you doing to help try to reset that vagus nerve?
Yeah, great question. We use some scans in the office that help us identify areas of stress on the nervous system. And then I use usually my pinky or my ring finger, and we're pushing so gently. Yeah. I try to tell mom or dad it's about the pressure you use to check a ripe tomato. We're just holding it. It looks nothing like adult chiropractic care, thankfully, and it doesn't need to. We are using very little pressure. It's very gentle, and we're using a very efficient or very specific spots that get us the most results, right? So for her upper neck on those nervous system scans showed us a lot of dysfunction and a lot of stress. So that's always been an area that we've focused on with her. And it's so true for kiddos in general. That upper neck is so important. Yeah. So,
traversing kind of down this, across this little, from an infant to a toddler. And, what would be some things, maybe we have some listeners that this birth trauma is resonating, and now they've got a 3, 4, 5-year-old.
Yes.
What are some things that as that child goes through the toddler stage and into just childhood that a parent might see happening that would give them a suspicion that there might be some issues that need to be addressed by somebody who specializes in this kind of stuff like you?
I think it, unfortunately, would be all the stuff that we have come to write off as normal, right? I mean, if we go back to that foundational side of the nervous system, we should be eating, sleeping, and pooping well, and then everything builds on top of that. So having a kiddo whose foundational part of the nervous system is doing well, as they go through that first year of life, and now we start having these motor development and neurological development milestones that we're looking for, we would see them move smoothly through that if there was no stress on their system.
Okay.
But so commonly, a kiddo who's very young might have colic or constipation. Very common, and pediatricians probably get visits like that all the time. As they get older, that same stress that has set up shop in the upper neck, if not addressed, turns now to a 1-year-old or an 18-month-old with chronic ear infections. That was me. I had several rounds of tubes, lots of antibiotics. So that we have these common, not normal, but common childhood challenges that, depending on whose perspective you're looking at them, we can say, oh, there's a medication for that, or they're going to grow out of that. And I've already said that's my least favorite thing, because they're going to grow into the next bucket of stress. They're going to grow into the next diagnosis. So by the time they get to grade school, kindergarten, first grade, now we're getting mostly boys who are diagnosed with ADD, ADHD, sensory issues. Yeah, and if we go back far enough in the case history, that stress has been there.
Right.
It should not be a surprise, but because we're used to calling it by different names and having different medications for it. The mom and dad might not connect those dots.
Yeah, that's so good, connecting those dots like that. And then, as I know, also I've heard some of this stuff being related to gut health, the enteric nervous system. I mean, talk a little bit about that, because that gut and that brain are connected for sure.
Yeah.
So how does that connect in your world?
Yeah, I always talk about things nervous system first, so I call it the brain-gut connection.
Right.
But it does go both ways. The nervous system goes both ways, and our brain is a constant processing center for the information it's getting from the body. The vagus nerve travels down through our neck, through the thorax, and into the gut, and it's one of the biggest players in the parasympathetic side of the nervous system, which is the rest, digest, and restore. And if that kiddo has been wound up in a fight or flight state, they are not prioritizing eating, sleeping, pooping. That vagus nerve has been shut down. That enteric nervous system is not doing what it needs to do because that body is in a state of fight or flight. So if we can get that baby or that kiddo to calm, that only helps the gut function. That only helps them prioritize things like sleep, things like digestion, and actually restoring health versus continuing in this cycle where they're wound up and sick.
Yeah, and so, it could be kind of the what came first, the chicken or the egg conversation, right? Like, did the gut stuff start because frequent ear infections, antibiotics, or did the frequent ear infections start from a nervous system issue that caused the gut issue? Now you've got this haywire communication, and you've got a kid that's really wound up in fight or flight constantly. I can visualize that and see that as how, ADD diagnosed kids, and I'm air quoting if we go audio before video, people can't see my air quotes, because it is so overdiagnosed. But they're wound up, and people think, no, they're just hyperactive, and no, their sympathetic nervous system is going, right?
Yes. Oh, yes.
So I would think you would kind of work on those simultaneously, maybe. Okay.
Yeah. Well, a lot of parents. The cool thing is now, I think that the paradigm has shifted. Parents are
shifting.
Okay, that's probably more accurate. It's shifting where parents are actively searching for different alternatives. I think that if we take a step back, parents of today have realized where such reliance on medications has gotten maybe their parents or their grandparents. Absolutely. And we see the medical system failing really on all levels.
Yeah, absolutely.
But we're seeing it for our families, that are older than us, and I don't think we want the same future for our kiddos. So I think there is a big push to change diet, to change chemical exposure at home. Right. What household toxins can we maybe eliminate, and what dietary changes can we change? And all of that is so helpful. As a chiropractor, the piece that I can help with is actually getting the nervous system to calm down. If you have a super calm nervous system and a really bad diet, you're still going to have problems.
Absolutely.
And vice versa.
Yeah, absolutely. Yeah. Well, shifting gears just a little bit, and this is probably going to be a whole episode in and of itself.
Yeah.
But I know you have a passion for autism in your practice. And, when I first heard that, I thought, I've never heard of chiropractic care and autism going together, but the more we've been talking, it kind of makes sense.
Yes. Yeah.
So let's kind of move into that conversation. And we are going to do a whole episode on anxiety and stress in kids and teens, because that is a whole conversation. So, just everybody hang on, because that's coming. And that's one of the biggest questions I get, because I'm able to help those problems in the parents. And then they're like, well, what about my kid?
Yeah.
But just let's talk a little bit about autism and how you got into that space. And
as I've keep diving deeper and taking care of kids, you realize that there are a lot of kids who have challenging stories. There are a lot of families that have kids with challenging diagnoses. And the more I've learned about the nervous system, the more I've learned about how chiropractic can help that. Having my own kids and seeing them thrive, and understanding that kids that are under chiropractic care have a calmer nervous system. And then I also linked up with a doc. He's up outside of Chicago. His name is Dr. Tony Ebel, who has really spearheaded a lot of work around what he calls the perfect storm and kids with autism. It makes so much sense. And they, through a series of what I really think is birth trauma, early maybe antibiotics or chemical exposures. There's other types of chemicals too. Yeah, all right.
You didn't want to say the V word.
No, I'll leave that up for you. there is just a slew of things that get stacked on top of these kiddos. And if we do that on top of a nervous system that is struggling, they are not going to experience full potential in their life. And the kids with autism, they end up being like locked in to their own brain and their own world. They don't make eye contact. They're nonverbal. They don't look around the room. And moms and dads do not have good options.
At all.
No, at all. And it's left, families and communities struggling. And autism is only on the rise, and there are no good solutions yet. I think it's 1 in 36 right now as far as the number
Why is
of...
that, you think?
Well, I think you can look at it a couple of ways, like you were talking about a minute ago. It's a chicken or the egg thing. I think it's a combination of stress in some form. Physical stress, I think a lot of it goes back to birth trauma.
In the womb as well.
In the womb, chemical exposures, which come in a few different forms. Then emotional stress, right? The emotional stress is certainly something that if mom is under a lot of stress while she's pregnant, if she's in an unsupported marriage, or there's a lot of, if she has some early warning signs, maybe they do the 20-week ultrasound, and they say, your baby's really big, or we're starting to see some red flags. That's putting extra stress on mom.
Absolutely.
We also now treat pregnancy, I think, like a medical condition, when really it's such a natural thing.
Absolutely. Don't even get me started.
So I think...
That's why I got out of labor and delivery. I'm like, other countries, they just squat on the side of the road, spit out a kid and go back to
have a baby.
Right? We make it such a thing.
It's a big thing. And I think that our support of pregnant women has only gotten worse. They work longer hours. They have shorter maternity leave. There's less focus on the family unit as a whole.
True.
All of mom's stress when baby is in utero is transferred to baby. And the first thing to develop in utero is that nervous system.
That's right.
So we're pre-wiring that baby's nervous system for stress, to live in that fight or flight. Chemicals is a big one, and there's a lot of places that chemicals come from. Dr. Tony would tell you that chemicals have been around for a long time, and older generations have had asbestos and lead paint that we've been exposed to. Certainly chemicals in our food supply. I think one of the biggest things that is kind of going under the radar is birth trauma. Our cesarean rates are going up. I said it earlier. I was a vacuum extraction. It left me in the NICU for two weeks.
Daughter.
And it just sets you on a path where now the chemicals and the emotional stress on top of a nervous system that we call it subluxation, that is subluxated, where it's extra stress, they are not going to thrive. That is too much stacked on top of them. They're going to live in that fight or flight. And like I said before, it's going to progress from things like colic and constipation to sensory to ADD and maybe even autism. I'm
going to just be real vulnerable right now. And just the things that we're talking about I'm thinking about my older daughter, Jordan, who's Eleanor's mom. And I was a young teen mother in an abusive marriage. Lot of stress in utero. Lot of stress in utero. I could tell stories about that. Vacuum extraction. This was an hyperactive, anxious child from the start. And I'm a young mother that doesn't know how to deal with this. I'm, under stress. And so then you move on, and then she becomes a young mother under a lot of stress. And all the kids. We've got a family of anxious kids. And you're helping them so much, by the way. We're going to talk about anxiety in a minute. But I can see what you're saying exactly with epigenetic changes just playing out in my own, child and grandchildren of my firstborn. And it's powerful. And I'm so grateful that she has gotten to know you, and she's got all her kids in there.
They're doing wonderful.
Their nervous systems. It's really, really cool. So what are you guys, back to the autism conversation, what are you guys doing and teaching and for these kids that is you seeing some progress?
So we spend a lot of time doing a deep dive with their day-to-day experience, right? No one is living that kiddo's experience more than that mom. Usually it's mom that brings them in, mom that's searching late nights on Instagram trying to find some type of a solution, a supplement, something that's going to give them some relief. And again, we're not treating the autism. We are treating that kiddo. And if we can help that kid and that mom find something, they've already, I'm sure, come in with an arsenal of essential oils and supplement. They've already cut out gluten and they've cut out dairy. They've cut it all out. And they're just not seeing all of maybe the behavioral changes go away. They're not seeing progress in maybe motor or developmental milestones. And that's when they dig deeper. And we sometimes have to go all the way back, right? I mean, kiddos are meant to eat, sleep, and poop. Once that is set, then our motor and our neuromotor systems develop on top of that. And there's there's sequence matters, I guess is what I'm trying to say. There is a normal sequence of development that we would expect. And if a kiddo is under stress, the sequence gets thrown off. Maybe we skip things, and we end up with a young adult or a young kid who now has suffered for, years of challenges. Usually it's not diagnosed till about 3. They can get official diagnosis, but the stress has been there.
Right.
So we're talking to moms and dads about what day-to-day challenges are you seeing? A lot of times it's behavior or lack of growth and developmental milestones. And every so often we're checking in with progress exams. We're checking in with how their day-to-day is going. And oftentimes we'll see those kids start to connect a little bit more with their outside world.
Nice.
They'll start to interact with their siblings. They'll start to talk to mom and dad a little bit, right? But we're not talking, maybe this isn't
what a gift that is to a parent who hasn't seen that. It gives them hope.
Yeah. And this is maybe a 5-6-year-old who they're not talking at the level of a 5-6. They're maybe talking like a 2-year-old. We have to go back to go forward.
Absolutely.
And any progress, we celebrate it.
Absolutely.
Because if you're not making progress in the right direction, then what's the point?
What's the point?
Yeah.
And so obviously you probably do some chiropractic care on these kids as well, and work on that nervous system and all of that. And that's and pooping.
The core of what I do as a chiropractor, right? I'm just a piece of the puzzle for these families. I mean, moms are the warriors that are out there getting all the care they need for this kiddo. So usually they have a packed schedule by the time that kiddo is 4, 5, 6, where they are going speech therapy, physical therapy, occupational therapy.
And I wonder, does that even add stress?
I think it does.
Yeah.
I think it does. Yeah. I think it's all helpful, but sequence matters. If we are trying to force, I think physical therapy is great. We have some great ones here in the area that I work with. If we are trying to force motor development into a nervous system that's not ready, then we're creating compensation that is not going to go away. We might meet that goal,
right?
But now we're just maybe creating longer challenges to undo some of that.
So knowing the timing of intervening in some of these areas is what I'm hearing you say.
It can be a tough conversation because moms only want to do their best.
Right.
And they are doing their best. Yeah. And sometimes maybe we're doing it out of order, or we need to pause some of the stuff that they've been relying on to take some of the stress off.
Absolutely.
And focus on healing that nervous system first.
Wow. And also I just kind of am tuning in on, we've talked about a couple of different things and even autism, but I'm hearing you say that you can really dial a lot of these things back with what you do to birth trauma.
That is where I look at things from. Yeah. It's a different lens. Yeah, yes, for sure.
Lens. Yeah. And by the time they get to a certain age and then on into adulthood, that cake is baked, but there's help for all of us.
Yeah, there is hope.
That are, hunched over things. So, wow, I'm excited about our next conversations around stress and anxiety in teens. And it's a big deal. But I really appreciate you coming on and taking the time and starting the conversations of, how important this kind of care is. Yeah. Now, one thing before we go, because I know people are going to be asking, how can people find, there's people listening to this all over the world, really.
Great.
How can it's not your everyday chiropractor that focuses on kids. So is there a special way to look for?
Yeah, we talk about that a lot. There's a great group called PX Docs. They have an online directory, and we are all trained in a very similar way, looking at the nervous system through this lens. And they're all over the country. There's certainly some international, though I can't tell you where they are.
PXDOCS?
Correct. .com. If you go there, you're going to find a ton of helpful articles that really dive deeper into what we're talking about. And you can also search the directory there to find, hopefully, one in their area.
Nice. Yeah. Awesome. Great. Well, thanks for joining us.
Yeah, thanks for having me.